Afternoon, everyone. Give me a minute here while I bring everybody into the into today's webinar. I am just bringing in some more folks, and we'll get started in a minute. Talk amongst yourselves.
Good to see everyone. Please put your name and where you're from or organization in the chat. I see some familiar names and faces.
Hi, Liz.
Hey, Miss Lowe, how are you?
I'm doing good. Hey, Jim.
Hi, Lau, how are you?
I'm doing good. How are you, Miss Leila?
Doing good. You might recognize a slide or two this afternoon.
I think several of my team members are on as well.
Awesome.
All right. I'm just going through, giving everyone permission to speak. I just, as a reminder, hit the unmute if you'd like to speak. There is a chat section, so you will be able to put in questions, comments, or whatever. Don't hesitate to direct message me if you have an issue with the webinar technology. My name is Jim Kelly. I'm the program manager for the Georgia Department of Public Health's 55+ driver safety program. We are running through a pop-up Raging Aging Symposium for Thursdays in the month of whatever month this is, September. And you all have invitations to register for any of the sessions. You're more than welcome to come to those. We'll have some more information at the end for some other items that you might be interested in. Let me get a few more folks here that are coming in, and we'll get started in half a minute.
Thanks so much to all the folks that have put your name and organization in the chat. If you're just now joining us, please, we'd love to know where you're from. I see some folks from this morning's community panel. Thrilled to see you back again. I believe anyone that's on might be able to turn their video on. No pressure to do so, but we'd love to see faces and really have this be a good discussion amongst professionals.
All right. I will bring in some latecomers as they come in, but we'll get started so that we can have some more time for questions and for interaction. So I've introduced myself. I'd like to also introduce basically my right arm, who on my screen is now sitting on my left side, but that is Lila Ralston. She is the program consultant plus driver safety program. Over on my other side is Elizabeth Head, and she'll be our presenter today. Elizabeth is going to be presenting on balancing the physical and cognitive changes that impact safe driving and mobility. Her area of expertise is aging and injury prevention. She earned her master's degree in public health from Georgia State University and has worked in public health for 16 years. As Deputy Director for the Injury Prevention Program at the Georgia Department of Public Health, Elizabeth coordinates the Be Seen project for Georgia, funded by the CDC. This project aims to incorporate public health into dementia and other Alzheimer's work that's happening across the state. In addition, she is a subject matter expert in driver safety for adults 55 years and older, and she manages the highway safety grants staff within the injury prevention program. She has worked with national, state, and local partners on a variety of injury topics, including fire prevention, drowning prevention, and falls prevention. Elizabeth spends her free time enjoying quality time with her family when she is not doing presentations for us, which we appreciate. So I will turn it over to Elizabeth. I will mute myself and go off screen while I do the back, and Lila will also be available through the chat. Thank you, folks. Talk to you in a minute.
Good afternoon, everyone. I'm going to pull up my presentation here. Hopefully everyone can see that. And then I also want to make sure chat is up so I can see everybody. Really appreciate everyone joining us today. I'm super excited to have this discussion with you. What I'd really like to do is have this be as open as a discussion as you'd like. Quite often my slides for a community are very similar to the slides that I put together for a group of professionals. We just talk about it from some different angles in terms of those we serve versus the folks, the end user, the folks that would benefit from the presentation. So please feel free to ask questions. I'd love to hear your perspective on what you've done at your respective organizations. My goal is to inundate you with as many resources as possible so that as you are going about your work, working with this fantastic population that I love, you have additional things in your tool belts. And it's really critical that we do attempt to balance physical and cognitive changes with mobility and independence overall, whether we're talking about driving, activities of daily living, fall prevention, brain health, all of those things really kind of cascade together to create this constellation of things that we can need to both consider as we're implementing programs, but also that we can utilize as we're trying to help our population that we serve. We are going to talk about what it means to age, talk a little bit about the data, and take a really deep dive into some of the programs that surround and are complementary to driving cessation and safety and mobility as an overall topic. So first of all, as a group, what does it mean to age? So how do you feel about aging as an individual or a professional? How do you feel about this thing that is getting older? I had a chat with my mom yesterday and she calls it OPS. I'm like, I live in acronyms. I don't know what that means. She called it old people syndrome. That's her words, not mine. But please feel free to put in the chat how you feel about aging. There's a lot that's going on. There's a lot of changes that are happening to us. A lot of changes that we see in the community and how we interact with our community. And so that's where this need to balance our independence and mobility with safety really kind of come into play. If you were on this morning, this is very familiar to you. Our rate per 100,000 drivers of fatalities is about 12.4 for the 0 to 54 population. We really jump up on those fatalities in the 55 to 64 year age range. And then over 65, you're going to see another jump. So from a professional standpoint, one of the things that we started looking at here in Georgia was, all right, so we've got this high rate of fatalities for our older population. And certainly if you break it down in your group that's over the age of 65, you're going to see additional fluctuations, particularly in your 75 and older population. But because we work in health and we do prevention, where does it actually start to go up? Does it start to go up sooner? And sure enough, in our data, we discovered that it does. What this allows us to do is, one, use this data to target our 55 to 64-year-olds, those folks that are still working, may still have older children in the home, are probably caring for someone that's older, parent, grandparent, other type of relative, maybe even a sibling, depending on their age range. Your average age of a caregiver is around 63-ish. And so all of those things are happening, as well as the onset of their own chronic conditions that they are needing to manage. And so this is really a population that's ripe to have conversations about safety and mobility behind the wheel, because driving cessation is the toughest conversation, one of the toughest conversations that you're going to have. So if we come in talking about these people that you care for that are older than you. We talk about, folks that are responding to surveys, learning from the survey questions as they go, absolutely employing that tactic right here, 100%. Because hopefully as they're speaking with the people that they're being a caregiver for who are older, we are allowing them to think about their own possibilities and their own plans moving forward. So when we think about what it means to age and how people perceive the elderly population, that is traditionally folks over the age of 65, this slide is not a surprise. We expect to see an increase in mortality. Where folks are typically caught off guard is when we go to this slide talking about this population tending to have fewer crashes. So that is for a multitude of reasons. Feel free to outline your thoughts on it in the chat if you'd like. It used to be that our 65 and older group drove less. Since all of our baby boomers are now firmly into the 55, even 60-year-old population now, that's no longer the case. Again, as I've already alluded to, these folks are working. They are enjoying retirement. They have camping to do, places to go, people to see, very active out in the world life as they maybe wrap up their careers and transition into retirement age, where they inevitably potentially take on second careers and travel more. So it's not as much that they're driving less. Certainly in your 75 or 80 and older, at least in Georgia, they are driving a little bit less, but for the most part, they're driving the same, or if not more than what they were before. So they tend to have fewer crashes because they self-regulate. They don't drive at night. They don't drive in adverse weather. They plan out their trips, more likely to wear their seatbelts, less likely to speed, less likely to be on a phone in terms of phone-specific distractions. Certainly other things can be distractions. But they know themselves and they know some of their limitations, and so they follow those. So that is typically why we see them involved in fewer crashes. Now, what are the physical limitations that impact safety? Everything that you see on the screen. So muscle weakness and foot problems makes it difficult to get back and forth between that brake and that gas pedal. So if we're in a physician's office and we're talking about physical items, it might be an opportunity to talk about fall risk, issues behind the wheel of because of a physical problem. Lila is going to put into the chat a really cool decreased range of motion. She's going to put in a link in the chat to a really cool clinical short article. Short is like 5 or 6 pages. But it's from Mayo Clinic, and it is a clinician's guide to testing that can be done, a concise guide to testing and what to observe in the population. And they take a really neat stoplight, red, yellow, green sort of approach to when there's low risk, medium risk, and high risk. They talk about utilization of several different strength and balance tests to help ascertain what the potential issues are. So as a group, using and recommending this to our physicians, which at least for us in Georgia, is our most difficult population to reach. I find that this article I think it was printed in 2019, is a really nice compilation of things. So, when you've got heart rate or rhythm problems or dizziness or difficulty with walking and balance, those things, if nothing else, they're distractions. Generally speaking, though, they make it difficult to turn around and see. Speaking of range of motion, they increase reaction time, which is a problem. Certainly vision problems also make it difficult to see what's around you, behind you, alongside you, and process what you would normally do. And I said this in another presentation, if you're a good driver at 30, at 80, you're assuming no huge physical or cognitive decline, you're still a good driver. you've just potentially slowed down a bit. And so the recognition of that as a driver is really important. Not recognizing that as a real safety concern. And so that's what we can really help folks with, and help physicians through appropriate tests like your timed up and go, your 30-second chair stand, your strength up and down. Those types of things can really help folks understand the physical things that are impacting their ability to be safe in their community, whether it's driving or walking or just interacting with family and friends. In addition to what typically happens to us because of, normal aging, and again, we're talking law of averages here, the other thing that we need to consider is how disease processes further potentially impact our mobility, our vision, and of course, our cognition, which we'll talk about more in depth here in a moment. At the advent of things like arthritis, it's difficult to turn, it's difficult to get your seatbelt, it's difficult to grip the steering wheel. Diabetes, you talk about diabetic neuropathy, you're talking about not being able to feel in your extremities, and folks don't notice those things. My dad was blind in one eye because of a cataract, which was completely correctable, but because our bodies compensate for that and people don't think about it because they're too busy going, that process to get that fixed becomes longer and potentially more difficult for something that's so easily fixed. Cognition is a big one. There's a lot of discussion on when a person should no longer drive. That 2019 article that's now in the chat talks about is even if very early dementia with really not any symptoms, overall the recommendation is to no longer drive. But that is a between the physician and the patient and their specific circumstance as to what decision is made, because the progression of this set of diseases that affect our cognition vary so wildly from person to person. It becomes really important that we have really strong connections with physicians on what to do. Your general clinician they're going to recommend driving cessation sooner rather than later, both out of concern for their patient, as well as just the unknown of how it's going to impact that person over time. So those are really tough conversations that have to be had. I do think that this article does a nice job of talking about some tests that you can do to get at what the potential increase for a motor vehicle crash is for a person, both in terms of physical declines as well as that cognitive incline. From a public health perspective, it becomes really important then, thinking of cognition, that we really understand the burden of Alzheimer's disease and dementia. Because the number of folks with some type of dementia is growing, that burden is growing. And so that burden impacts all of a community. There are additional health disparities among Alzheimer patients, our African-American population and Hispanic population. We know that there are some barriers to educating and helping those folks get the treatment that they may need. The burden of care on caregivers is incredible. They ignore their own health. That's part of the reason why we started looking at driver safety in Georgia at 55, because we recognize some of those additional burdens that the caregiver population has. There's a workforce shortage, and folks in the workforce are currently untrained to meet the needs of folks with some sort of dementia or cognitive decline. And so in that, we have to think of what our public health role is. And I know not everyone on the call today works in public health, but our Department of Transportation partners are critically important. Our Area Agency on Aging, our AAA, the Car Club partners are really important. And the public health partners are really important in this. So typically public health is going to work in surveillance and data monitoring the data. We talk a lot about risk reduction and overall cognitive health. We look to warn folks about the warning signs of dementia and the benefits of early detection. Certainly for our CDC grant here in Georgia, we're looking at how we can get towards early detection and getting folks to really speak with their physicians a lot sooner than they normally would. And then to address that workforce issue, training healthcare providers, family caregivers, your formal and your informal caregivers really becomes important so that they feel as though they have some tools to help themselves and to help the people that they're caring for. Through all of this partnership as professionals, it will absolutely make or break these efforts. Here in Georgia, we would not be able to do this work without our friends at the Alzheimer's Association or our state unit on aging. As we look to really take a deep dive into dementia and mobility and driving safety as a whole. So here in Georgia, we created the Think About It campaign, and it's talking about things that your doctor may ask before an assessment and then during an assessment, and then the importance of reducing your risk. So any of these programs that you see or any of these items, cardio exercise, heart healthy, eating healthy, sleeping well, smoking cessation, preventing brain injury, any program that exists in Georgia, what we're doing now is working to build brain health as a regular part of those programs, just so folks can start hearing the word brain health and brain strong as part of other chronic illnesses and injuries that they might want to think about. We have some really cool graphics. I'm going to show you this first one. If you have forgot your way to the grocery store again, you might want to think about it. Maybe you're stressed because we've been in a pandemic for 2 years. Maybe this is a new change, and that's a problem, and you should think about the reasons why. As I have said in other presentations, medications can make this happen. It doesn't mean you have some kind of cognitive impairment. It means that a medication is affecting your ability, and that's the time to have a conversation. As a professional, I'm always using for tools to help me get the word out. And so here in Georgia, we've created a Z card. Hopefully you can see this. It literally looks like a business card from the outside. Looks like a Z right here. Pretty neat. GeorgiaHealthyBrain.org. Thank you, Lila. But then it folds out into an entire 8.5 by 11 piece of paper. It has this particular graphic on it. And then on the back, it has all of the risk factors that you can address. And it directs people to their physicians to have the all-important conversation about what's happening with my memory. Why am I getting lost? Why am I struggling with numbers, which is another one of our graphics? Why am I having trouble connecting? You know, and these are new behaviors. As I was telling a colleague before our discussion this afternoon, I have struggled finding the right word my entire life. That is not a new behavior. It hasn't gotten worse. That is my ADD brain just flipping through too many words at once. However, connecting and finding the right word and losing connection in relationships, those are potentially new behaviors that someone would want to have a conversation about with their loved one who's exhibiting those new behaviors, and with their physician if you've noticed it in yourself. So overall, we want to think about reducing injuries for our aging population. We want to create that balance. There's a number of things we really have to take into consideration. And along with taking these particular topics into consideration, we need to think of our partners that are doing that work already to make that job a bit easier. So nutrition and hunger is a big deal. Food insecurity is a huge problem. It is something that really makes it difficult for folks to function. And when you are hungry, you're not thinking about anything else. You're certainly not thinking about not being able to see as well. You're certainly not thinking about your safety. You are trying to find a meal. And your body's trying to find a way to, survive. So that really impacts folks' ability to be safe within their environment. Exercise and physical activity There's a really great joke meme that says chasing the ice cream truck does not count as your summer fitness activity. It's kind of true. We don't want to talk about exercise. We don't want to talk about any of that, but being physically active really solves a lot of issues. So where we can bring up physical activity is really enhances any type of messaging that we're trying to get across when we're looking to create this balance. From a public health perspective, approaching this work through the ecological model is really useful. If you're not familiar with the ecological model, it essentially, it's in as little as 4 sectors, but it can be, or concentric circles, but it can be larger or more detailed if you wanted. It starts with the individual, and from the individual, it goes to family. From family, it goes to community. From community, it goes to society, including like national government organizations. And so when we think of driving safety, there's certainly the things that an individual can do to keep themselves safe, hopefully. There are things that we would want the family to consider. There are environmental things that could happen in the community to help with that. And certainly at a national or societal level, there are also laws, policies, programs that could also help. That way, at any given time, we're working on the problem from different angles and from different groups, and that really helps drive home the point of any given topic, frankly. But on this one, it becomes important to have programs and discussions across all of these different areas. Thank you for that, Lila. Next, I want to talk to the group about what it means to drive. Why does everyone fight to hang on to their keys? And a question for the group, just to make sure we're all still here and awake. At what age should you quit driving? Feel free to put it in the chat or take yourself out off of mute and shout it out. At what age should we stop driving? Aging is a Western, the good, bad, the ugly. Probably start thinking about it at 75. Okay. Okay, I like that. As a health educator, if I ask this question, and I've done it before, it's pretty funny. If I ask this question, absolutely, Lila. If I ask this question in a room full of older adults, they look at their partner first and they say, you should have stopped driving 10 years ago, and laugh at one another. Typically speaking, an individual will say that whatever is 10, 15 years older than them, that group should stop driving. It doesn't matter if you're 20, 60, or 100. I've literally had a 100-year-old that said he would considering no longer driving when he hit 110. He was perfectly fine until then. We're very attached to our keys. I'm seeing a lot of really great comments in the chat. If you start having small accidents, if you're afraid to put the grandkids in the car, when your safety or the safety of others is at risk, when you're a threat to others, absolutely. A lady in California with a perfect driving record well past the age of 100. And that's the thing. It's completely subjective. As professionals, we really have to help folks understand, one, where their responsibility lies and where they can see issues. And then we have to help families understand what it means to drive. So as a group of professionals, the other question I ask is, at what age should you get your first set of keys? And if you were here this morning, don't you answer and ruin it for everybody else. But when did you get your first set of keys? Feel free to put that in the chat. Typically, the responses are going to be somewhere in your teens, anywhere from 14 to 21. Yeah, exactly. What we actually have is just to challenge you a bit, is we got our first set of keys when we were much younger, like toddlers, babies even, hopefully not these things that make all this noise. And those keys were cool because we played with them and we were like mom and dad or our other relatives, and it was awesome. And then we got our first set of real keys. I absolutely had a Batman keychain on my first set of keys and was happy for it. I would bet a lot of people here could remember what they had for their first keychain. You certainly remember how you felt with that first set of real keys, right? Independence, freedom. You may be grinning right now at just how it felt to get in the car and go, even though you knew you were going to be in trouble when you got home. So what other sets of keys have you had over your lifetime? Your first car that you bought yourself, your first office, your first home or apartment, or both. Yep, keys to the house. Even as a teenager, I got my first set of keys to the house at 13 because we were a latchkey for about a year and a half. And that was huge because I got trusted with the keys, but my sister didn't. Haha. So all of this stuff represents major transitions in our life. And so at some age, the motorcycle, absolutely. At some age, someone says, well, I'm worried that you're going to cause a crash, so we're probably going to take away your keys. That really enrages people. It really creates animosity where there is no room to have animosity because it's such a sensitive topic. And so it's important that we break down these conversations. And first of all, understand that meaning of driving. 2, observe skills. So what we know as professionals is you're going to see unexplained dings and dents on the car. You may observe sort of this hesitancy or trouble going from the gas to the brake pedal, frequent starts and stops that they maybe didn't do before, minor crashes, a lot more road rage, a lot more upset with the environment around them as they struggle to interact with that environment. So that observing driving skills is also important, because when we understand what it means to drive, but then we observe a car that is in perfect working order, they have no issues, they've decided themselves they're not going to drive at night because they don't see as well and they understand that. And there's none of those issues. There's no reason to take away the keys. Always a reason to plan, always a reason to plan. We planned for retirement, or one day to retire. We plan what we're doing in our careers. We bring an umbrella because then it, quote unquote, won't rain, even though it probably will. We've got to plan conversations. And this is such an opportunity for us as professionals to plan those conversations. There's a really fantastic group. They're called the Elder Care Locator. I really hope that's not backwards. And they have a trifold that says, before you give up the keys, create a roadmap for transportation independence. Don't try to read this, but it talks about the different things that people go through physically, cognitively, and it has a transportation planning worksheet. This is free if you're going to print it yourself. They basically just charge you shipping if you want them to print it for you. Super inexpensive from the Elder Care Locator. And that Lila has it up there for us. So this is a really powerful tool. There's also the CDC My Mobility tool, which doesn't just talk about driving, it talks about home safety, and it talks about fall prevention and how you would be mobile throughout your community. So planning your conversations has to center around making these plans when you're talking with your members of your community. And the reason why we are really needing to make sure we plan for mobility is because we really see in our literature and just in real life, depression, loneliness, boredom, really, and all of these things, this sort of constellation of issues contributes to the overall cognitive and physical decline of a person who is no longer driving or who is isolated from their family and their community. Think of the pandemic and what we've seen in terms of how people have aged so much over the last year and a half. Absolutely. There's a great point in the chat right now. Sometimes there is a temporary need to give up driving. Making a plan for that, one, helps the person in the immediate. Two, creates a segue for long-term planning. And we have to have that plan. So, you know, Mom, how do you want to do this? And we'll go over some conversation starters in a minute. Because this is such a difficult conversation to have, I like to broach this either by talking first about fall prevention, because everyone wants to know how to not fall. And so you talk about fall prevention, and you talk about if you're at risk for a fall, you're also at risk for a motor vehicle crash. And then that will at least get them to listen. The other item is to talk about safe cars and insurance discounts. Everybody likes a discount. I don't care if you're 5 or 55, everybody likes a discount. So you can tell the people you're chatting with and educating to check with their insurer to see if there's an approved course on defensive driving that they can take, which is really fantastic. In addition, your owner's manual is really important to read. And I have put the wrong slide on here because there is another great website. It's called Know Your Car, or no, What Does My Car Do? Lila will put it into the chat for me. My Car Does What is the website, and it really talks about safety features across every brand of vehicle. That is really a phenomenal way to start giving resources to this group so that they understand things that they can do. Because when you understand things you can do, you are empowered to take the next step yourself. And that's why we're trying to do here ultimately, is empower a population to work on these things before they become an issue. Other really important tool for all of us as professionals is roadwiserx.com. This is put on by the AAA Foundation for Traffic Safety. It's a fantastic website because it doesn't save information. You can type in any medication, prescription or over-the-counter, herb supplements, vitamins, all of it. And if it's in their database, it will talk to you about food interactions, health interactions, potential for issues behind the wheel. And it will tell you how different medications might interact that could cause an issue for you while you're driving. Anything that impacts your driving safety. Folks love this website. Often they'll put in all their meds and then they'll print the list because it will allow you to do that. And then they take that whole list to their doctor to have a whole conversation around medication. In addition, we have our driver self-rating tool. We love our driver self-rating tool. This was created again by AAA Foundation. That is on the website in front of you. Here in Georgia, we took a spin on this and updated it a bit with AAA's permission so that it had greater readability and contrast, which when we're talking about mobility and independence, any materials we put out, they've got to have good contrast. They have to be readable to the population that we're serving. So Lila has put the website into the chat for you on this specific rating tool. But if you're interested in it and you were not at this morning's presentation, please put your email in the chat and we will email you a copy of the Georgia version of the self-rating tool. It's a really great tool. We've printed a lot of them. We've had a lot of them at our educational events and folks fill them out, and it's a really nice tool. CarFit, fast, fun, and free. It does not assess your ability to drive. It assesses your ergonomic fit. They are not allowing us to do live events right now. What they are allowing us to do is online events that they're hosting so that you can learn more about the program and get some tips. Either as a professional or, you know, to save their videos that they have for your online offerings as a professional to your community. Really fantastic references on minimizing your blind spots, on how far away you should be from the steering wheel, which you should be 10.5 inches away from the steering wheel or more, basically the length of a piece of paper, because you want the airbag that comes out at 200 miles an hour to do its job as opposed to hurting you. So it covers those in various video tidbits, like super short 1 to 3 minute videos, which are a really great tool if you're trying to do virtual educational offerings on how to be safe behind the wheel of a car. Resources to assess safety and sharpen skills. This is strictly here for you as a group of professionals. I'm not going to go through each one, but at the end of the day, if any professional has a problem, your general practicing clinician or other folks, the typical recommendation is to send your patient to a certified driving rehabilitation specialist. And we have to do that because they are an occupational therapist with additional medical certification to assess a person's driving ability and their overall health situation to find the safest route for them to stay mobile in some way. We want to make a plan, as I alluded to earlier, and I want to spend some time on conversation starters. I would love to hear from folks in the chat. Take a moment to read through this. I might read a couple of them. And how would you start a conversation with someone who shouldn't be driving anymore? Or someone, you want to convince to make a plan for being mobile in different ways. So I know in my household, we do things as a group, like we take MARTA to get someplace, even though we're not actually close to MARTA, but we want to learn how. I took my daughter to somewhere via taxi because she was taking a trip to Chicago for a band thing, and she'd never taken a taxi before. So we did that together. Do a fancy, fun dinner, but take some alternate mode of transportation to get there. Does anyone have questions about conversation starters or tips that they've done in their line of work to help other folks that are having to navigate these conversation starters? Okay. It's a great way to keep engaged, is to keep having these conversations about mobility, both directly and indirectly. In Georgia, we have 12 area agencies on aging. Please know that every state in the country has area agencies on aging. It just varies by state how many they have. We've got an enormous amount of counties in Georgia, 159. So we have more area agencies on aging. Here in Georgia, you can call Empower Line, which you see that number ending in 3333 in front of you. You can call that line from anywhere in the state, and it will direct you to the appropriate area agency on aging. So, and then you can then be helped by certified information and referral specialists for driving, for meals, for physicians, for assistance with bills, for assistance with getting around in your community. They really have a great handle on different things going around. I love, Melanie, that you talk about using Uber for short trips. That it's so fantastic to use where it's available, and it's pretty much available almost anywhere now. We used to ask the question, what would you do if you couldn't drive anymore? Like if I took your keys right now at an in-person event, what would you do? And that really got people thinking. Now everyone just says I'd take Uber, which is great. It's great that that exists. When we think it's still a fairly pertinent conversation when we are out in rural areas as to how it is that they would get around. I've literally had folks say, well, I would just hop on the tractor or my golf cart if I couldn't drive anymore, because they don't consider it to be the same. So that's where we have to be careful, but using Uber, using Lyft, they're really fantastic ways to get around that are really up with the times, and everybody has some kind of smartphone these days, so it works out well. Department of Driver Services. We may have some folks from Georgia Department of Driver Services on the call today. We're so thankful for them. They work really hard. Right now in Georgia, renewals are every 8 years for adults. Their senior page has great mobility resources and transportation options. They are also in charge of the medical revocation process here in Georgia. And I want to take some time to talk through that as a group of professionals, because it's the last tool we want to use, but it's a really important tool. So in Georgia, there are several types of medical revocation. I'd like to thank Lutheran Greer for this slide content, because it's her slide I just borrowed. Type 79 is about alteration of consciousness. So that's essentially anytime you like syncope, those types of things. So 1 year from your last episode. Type 80 is an epilepsy revocation. You have to go 6 months without driving, but that is a type of revocation. An emergency revocation would be immediate. There are some very specific parameters around an emergency revocation, but it can happen. It's just not the usual route. Physical and mental disability revocation. This is all of your general medical and vision type of revocations. And then one option for folks, sometimes you see that type 95 down there at the bottom. It is possible for a person, so let's say you're really having trouble with your vision, it's bad. And you go to a certified driving rehab specialist and you go through that process. They may recommend a bioptic lens as a way for you to continue driving. Now, when you get a bioptic lens, that is a specific type of license. You have to take a test for it. It has to be renewed every couple of years. It's a very intensive process because it is a very specialized way in which to stay behind the wheel, and it requires just as much of a skill set as originally learning to drive. It's a completely different way that you have to learn how to drive. So what we do is it's potential to have that bioptic lens license cancel, and that's a type of revocation. Most of the revocations are going to fall, however, under type 91, which is the physical or mental disability revocation. And anytime that happens, that typically initiates a paperwork process at Department of Driver Services, which I'll talk more about in a moment. If there's any disagreement on whether or not to revoke a license, it goes to the Department of Driver Services Medical Review Board. Not all states have a medical review board, but most of them do now. In Georgia, and actually I think there might be 9 specialists, 9 board members and 8 specialties now. But internal medicine, geriatric, psychiatry, orthopedic surgery, hospice, neurology, and ophthalmology. So these board members serve a 4-year term. And anytime there's a disagreement on the medical paperwork that comes back on a driver, they meet and discuss the case and make a determination on whether or not the person is allowed to retain their license. Now, how do we get into the medical revocation process? Our 55 plus driver group worked with law enforcement and with DDS probably about 10 years ago now. And they created a request for driver review form. It's DDS form 270, I think. And this is a form that you can fill out. Anyone can fill it out. Neighbor, family, police officer, physician, anybody can fill it out. You have to put your name on it. However, the person for whom you're filling it out for is not notified that you created the form, filled out the form, unless there's an appeal process. The middle part of the form talks about why we're requesting a driver review, and then you send that in to Department of Driver Services and initiates a paperwork process. That paperwork gets sent to the individual. So if someone reports me as being potentially a danger behind the wheel, let's say I have some type of medical and physical condition, I'm going to receive a letter from Department of Driver Services here in Georgia. That letter is going to say, we are requesting a review of your health and fitness, and they're going to maybe request that my eye doctor and my physician fill out some forms and send it back to DDS. If I do nothing and ignore it because driving is my right, which that's the thing many people believe, then DDS is going to send another letter. If I am unresponsive at that point, they then revoke the license or suspend the license. If I take the paperwork dutifully to my physician fills it out and says I'm fine to drive and everything goes back, then I'm fine to drive and nothing is done. If the physician says I'm not okay to drive, but my vision specialist says I am okay to drive, that is when those documents are received, the DDS medical review unit, the board will review and make a determination on my case. It is possible to appeal. If anyone has questions about that, we would love to have our DDS folks take email questions that we can compile for you. Appeal process doesn't happen a ton, but it does happen on occasion. So, and we'll leave it at that for now. For me, these are the slides that I have for you today. I really, really appreciate everyone's time and attention, and would happily entertain any questions that you might have for me at this time.